Namaste and welcome to the 61st edition of Bodhi Stree. And you remember that back in April, when we did the first episode after the International Women's Day, we said that this time, this entire year, we are going to devote to talking about mental health. So, Bodhi Stree for mental health is what we started off in April. So, after two conversations, the third conversation today, I have the pride privilege to have invited Dr. Sujata Naik to come and talk to us about how both physical and mental health are so integrated together. So before we get on, it's important for me to introduce you to Dr. Sujata Naik. It's truly a privilege to have her here because today what she's going to talk about is actually what she truly believes in, practices in, and informs her entire life with. So Sujata is a homeopath with more than 30 years of clinical experience, but you'll have many homeopaths with more than 30 years of clinical experience. What makes her different is that she's always been very, very research oriented. Her research is widely acclaimed in the world. In fact, many of them have won awards, and it's usual for us to see Sujata representing the community at so many international forums. And she's run a charitable OPD for the last decade or more, Sujata, more than 13 years now
Yes,
in rural
13 years. Yeah.
Maharashtra. Yeah, 13 years. And you know what? The fact that she believes in this so intently and is clear from the fact that she's written two books called Wellness Shots and Wellness Capsules. Both are the idea of how health is a holistic practice. It's not one part of it that makes things happen. So today we'll talk to Sujata and she'll help us deconstruct how mental and physical health are so integrated there cannot be any fine line also between them, and how both talk to each other to give us the life that we want. Given that the generations of the future and their health lies in the hands of women, it's very important for us to have this conversation. Thank you so much, Sujata, for making the time to come and talk to us. We know what a busy practice you have, but thank you so much for making the time.
Thank you. Thank you, Sona. It's a pleasure and an honor to be with you all today. And I welcome all the viewers who have logged into our conversation. Thank you.
So the first question is the very, very obvious one, Sujata. I remember that the first time that I was wowed by your perspective on this was when you were actually talking to a band of women, many of us, about how both physical and mental health are so integrated, how the mind and the body are so integrated. Help us understand that. And take your time. We have all the time to listen to you and help us understand this.
Absolutely. Thank you. Thank you, Swapna. And this is really a subject very close to my heart. You said it right. And I've been in a healthcare provider for more than 3.5 decades now. And I see the kind of, the variation, the variables in health. And while conventional medicine looks at mental health and physical health as separate entities, holistic health actually believes that the two cannot be separated. They are deeply interconnected. And I think modern medicine is also coming around to now doing a lot of research in this area. In fact, the mind and the body are so intertwined that everything that the mind feels, the body is going to reflect. And every signal that the body gives, the mind is going to emote. So, it's so deeply interconnected. In fact, modern science has now, there is a lot of zeroing down on what we call as the PNEI axis, the psycho, neuro, endocrine, immunological axis. So which means that whatever starts in the brain goes on to the nervous system, goes on to the endocrine system, to the hormonal system, affects our immunology, and then it's an entire cycle. It's immunology affects all these as well. So it's an entire cycle. So if you look at it, to just give you a small example, that if when people suffer from grief, separation, anxiety, or stress, then we often experience symptoms like headaches or a persistent low feeling, or sometimes irritability, sometimes digestive disturbances, or even in women, it could be menstrual irregularities or hormonal disturbances. It could also be recurrent episodes of cold, cough, or those who have a history of any kind of a bronchitis, recurrent asthmatic attacks. All this kind of zeroes down to the fact that immunity takes a huge hit when you're not mentally, sound, or when you're not absolutely in great shape mentally or emotionally. Similarly, when you have a physical disease, like chronic diseases like diabetes or high blood pressure or cardiovascular ailments, chronic cardiac issues, or even autoimmune disorders like rheumatoid arthritis or severe skin conditions like psoriasis or any other severe condition, this affects the mind. So a person with a chronic illness or a persistent illness is not going to feel on top of the world. He's not going to be able to, because then these things also lead to low moods, depression, lack of motivation, sleep disorders, and then finally, the chronic fatigue syndrome. So this way, the mind and the body are so deeply interconnected. And as doctors, as physicians, we see this happening almost every single day. Every patient who comes with a physical ailment, we can trace it back to some kind of disturbance at the emotional level or the dynamic level. And somebody who comes with a specific mental or an emotional ailment, we can trace it back to some physical illness that has not been either addressed or not been cured. So this is how the mind-body connection is so deeply interconnected, especially from the physician's point of view, from the health perspective.
What you say is so true, and I think intuitively everybody knows this. But I do not know why we just forget it as we live our life. We just start thinking that they are separate. So, in your practice, you've seen women coming, and especially I would want to talk about the younger women coming, the ones who have very stressful work lives.
Yes.
How is it actually panning out?
In fact, I would say, Sapna, that modern life has not been very kind to women. In fact, women have
Not at
stopped
all.
being kind to themselves because
Yes.
when they are now balancing so many roles, so many roles, professional, their careers are on a swing, on an upswing. Then they are their daughters, their daughters-in-law, their spouses, their mothers. They also have to manage so many things at home because unfortunately, though a woman's career trajectory is almost like many women have experienced career trajectories as equal and as perhaps as strong as men, the male counterparts. Unfortunately, they do not get the kind of concession that a male would get in a similar position, especially in our Indian setting, in the traditional Indian setting. So this what has happened is, in fact, I'll tell you that I see so many patients coming with, when you trace it back, they say, oh, my career is great, but just I'm able to go out and work and pursue my career. And I think that's a huge privilege, but it also puts me on a guilt trip because I feel that I'm not giving enough time to my family, to my spouse, or to my parents or parents-in-law. So I need to work doubly hard to make them happy, to keep the house spick and span. So this connotation of superwoman was, I think, invented, which is so wrong because women have and they kind of they are actually happy. They kind of indulge in this that given to them. This is actually not an accolade, I would say. It's time for women, whoever is branded as a superwoman, to sit down and think that is she doing justice to herself? Because why, when she's playing so many roles at the same time, she's probably, compromising on herself. She's compromising on rest, on recreation, on sleep, or maybe some hobbies, and perhaps even medical attention. Sometimes, so women sometimes, and very often, symptoms which are very innocuous, look very innocuous, look very simple, like persistent fatigue or fatigue which is out of proportion. A patient will come and say that I used to do the same work earlier, but now I get tired more easily. I'm very tired, but I'm not able to sleep. My sleep is disturbed, or my digestion hasn't been up to the mark. I don't enjoy food as much. Do I eat a lot more, but I don't enjoy it as much. The things that used to give me enjoyment earlier, those hobbies, I'm not able to pursue them. My energy levels are low. In general, I have experienced fatigue, irritability. And they often attributed this to age, growing older, or hormonal issues. And they say, oh, this happens. Everybody will say, oh, this happens. To women about 35, oh, you may be like maybe about 40 now, maybe you're in the premenopause, you're in the perimenopause, and all these labels are attached. But this is not something that they should take in their stride. There has to be some kind of a solution to this. They sit back and understand and introspect why this is happening. And if they can correct it by, correction of lifestyle measures, they should do it. else they should see their physician. In fact, I would say that every woman at whatever age must regularly visit a physician, even if she feels well, because there could be subtle signs, subtle things that are not picked up, which a physician may be able to pick up. And I always tell patients is that see your GP or see your family physician or any doctor that you believe in regularly when you are feeling well, when you don't have symptoms. So he will be able to recognize the aberrant symptoms or whatever is erring, whatever is bothering you when you're not well. It will be easy to pick up the disease symptoms because he knows your history. He or she knows your history or knows your the entire life cycle, whatever your predispositions are, whatever your problems are. So when you are actually sick or when there is something really wrong with you, he'll be able to pick it up. So this is what I tell women is that the balancing these acts, you're actually compromising on self-care and thinking that self-care is being selfish, which is again a very, very wrong thing to happen. Because if you are healthy, then you can actually, there is so much more productivity that can come out. So this is something that I would really tell all women is that don't get into this super thing. You must be able to understand where and what is happening to you, pick up things, signals which your body is telling you and address them as and when necessary.
In fact, I was about to ask you this question that what does it mean listening to the body? But you've given it a totally different, what should I say, lens. You're talking about not illness, but wellness. So you're saying that do not wait for the body to become ill before you actually respond to it.
Yes.
Because many of the things that you mentioned, Sujata, I think it applies to even me that I would think that, oh, I used to be very energetic, not anymore because probably it's age. And then there's these so many labels of perimenopause, menopause, which are actually, there's so much of an possibly correctly so overreaction to this, but it's making people feel that that is a reason why they are feeling unwell, which what you're saying is it should not be that way, right? It shouldn't be that you
Well,
feel any less than your.
we will definitely come to that, the stages in a woman's life. But what I'm saying is that a woman generally tends to overlook symptoms. She kind of brushes them under the carpet. Oh,
Mm.
I need to do my test. I'll do it tomorrow, day after tomorrow, 3 months
Ah,
later. Let me look at the family first. So, that's what I said. When they're balancing all these roles together, they are pushing what is most important under the carpet, putting it on the back burner, which should not be done because they must first, the primary responsibility of every individual, man or woman, is towards himself or herself. And
of course.
unless you take that responsibility, because we get into the women especially get into the sacrificial mode, and then
Mm.
there is so much of uh, you know there's a
Yeah,
tiara on each woman's head who sacrifices, and we kind of really utilize sacrifice so much that
very
sacrificing health
true.
for everything else is certainly not done.
Yeah,
So that is
not
something
done.
we need to take care of.
In fact, it reminds me, Kalidas had written somewhere, I think in the Raghuvanshan, that Sharirasya dharma khalu sadhanam. That means Sharir
Absolutely.
is the sadhan, is the means for actually
Absolutely.
practicing your dharma or discharging your duties. So if we as women think that we are dutiful, the first job is actually to maintain our bodies
Yes.
because this is the
Yes.
only instrument that we have to actually discharge
Absolutely.
our duties
Absolutely.
as they are. I also think, as you
Yes.
were mentioning, and I've also seen that those women who practice their profession without any resistance from the home front are obviously feel almost obligated to do enough and more for their families. And I think that's where this whole
Absolutely.
rights conversation comes, that it is a woman's right to step out and do what she does. So if your family members are actually not coming in the way, they are not doing you any service. And
They
there
are
is,
not.
I mean, it's just your right to step out and express your personality the way you want to. So it's important to probably introspect for everyone that are you overcompensating
Yes.
for your family's support by actually destroying yourself? It's,
Conversely, Swapna, I would also like to mention about homemakers here, because there
hmm,
are women who choose not to, though they are educated
yes.
and they could have pursued a career, probably for the family, for the kids, or maybe because the husband was on
Hmm,
his
hmm,
own
hmm,
trajectory, and if she had pursued an
hmm,
equally hard career, it would have actually
hmm, hmm,
compromised on the home front. So she
hmm,
chooses to be a homemaker, or maybe sometimes she has been asked by the spouse or the family to stay back at home to take care of responsibilities. But these women get into the victim mode later because they have been denied or have been suppressed. So then after a certain age, because she's so relegated into the background, she's so taken for granted. Because what are you doing sitting at home? There's no value to that the work that she does. In fact, sometimes I would say that it might actually be simpler to go out and work because there could be
Yes,
some yes, there could be some respite the woman gets because she has an
I
identity,
agree.
a recognition of her own. But a woman who stays back at home, she sometimes misses out on that kind of life, on her own identity, on her own recognition, about her own place under the sun, because the children, until her focus was her family, her husband, and her in-laws, she was managing very well. But now that the nest is empty, the husband is on his own trip, the in-laws probably are not there or they have exited. So now it's time to look at herself, and she isn't trained to do that. She doesn't know how to look after herself. So then this there comes a huge empty hollow feeling. And then she gets into this victim mode. Here again, this kind of woman also neglects her health because she feels that I have done everything I could have done for my family. Now let me do things for myself. What does it mean? She has now access to this social media. We have access to food, so there will be unnatural cravings happening, which will lead to hormonal disturbances and other things and weight gain. We'll, of course, come to that again during our talk. But this is what happens. So women especially need to listen to this, to concentrate on their health, physical as well as mental.
And we need to also clarify what self-care really means to
Absolutely.
everyone.
Absolutely. Yes.
Self-care doesn't mean the usual thing of actually going and indulging yourself with something which actually probably destroys your
Absolutely.
health, which is actually happening. So there's a question which has come from the audience also, but I would want to lace it with the question I had in mind, that with different stages of a woman's life, what are the kind of challenges that she faces, and how does it usually affect women mentally, and how should they go about taking care of this?
Yes, that's a very relevant question. I could just go
Yeah.
on for hours just because it's
Yeah.
so
So
broad.
So
But
there is a
trying
question,
to,
Sujata. There's
yeah,
one
trying
on
to make it
adolescence. There's one stage is adolescence, and there's a question which has come. So I thought I'll just put this here so
okay.
that you can include it. That can you please throw light on the current PCOS, now called PMOS, and why are so many young women getting diagnosed with it?
Well, we will definitely get to that in our discussion later. But now that you've mentioned it, I can talk about it. PCOS is a very, very modern disease, I would say. It's not really a disease, it's a condition called as the polycystic ovarian syndrome. And it used to be called disease earlier. It has been changed. Now it used to be PCOD earlier, and now it's PCOS. It's no longer a disease, it's a syndrome. So,
Hmm.
and it's a combination of several factors, especially seen in girls, say between 15 to 25, 30, 35 years of age. And the basic thing is about irregular menstrual cycles. So these girls don't get regular cycles. Perhaps there is a disturbance in the ovulation system. There could be, and then associated with weight gain and secondary hirsutism, that is hair in unusual places, and overall lethargy. It could also be coupled with something called hypothyroidism. So your thyroid also becomes sluggish in the process. And then these, if it is not addressed, the main risk in this is, of course, infertility after in the childbearing age. But also, it means that such women are more prone to what is called as a metabolic syndrome. So they may develop a lot of obesity later on, and then hypertension, and then they can get into something called as pre-diabetes first, and then going on to diabetes because of the obesity. So it becomes an entire syndrome. So this needs to be addressed. And why does it happen? It happens because of all the factors that we mentioned earlier. This is in adolescence. Girls have to be, mothers should be especially very vigilant, about keeping the girls active. They have to have good nutrition. Physical exercise is an absolute must. Today's students will go to school, they will spend the entire time sitting, studying. There's hardly the PT periods are also converted into either reading classes or just sitting and gossiping. Most of the children skip the PT classes also, but they don't understand that physical education is such an important part of the daily curriculum. And then she comes back, the girl, I'm talking about the adolescent girl, say between 12 and 15. She comes back, she has classes to attend, tuitions. She goes, comes back. And then how does she relax? There's no physical activity throughout the day. How does she relax? She will take the mobile in her hand and start scrolling. Either it's Facebook or Instagram or it's WhatsApp and social media. And this is all, there's dinner and then sleep. So this is the typical cycle. And what does this then happen? There is so much of abdominal obesity. These girls generally develop a lot of weight around their abdomen. This also affects the regularity of the menstrual cycles, and then so on and so forth, which I just explained earlier. So this is PCOS. This is completely preventable. This with proper lifestyle measures. And in some cases, it could be a deep-seated hormonal issue. It could be a inherited pattern. Of course, though the gynecologist will deal with those. But what is important is that something which is so easily preventable with the correct lifestyle measures is now becoming like an epidemic. I would say almost one out of maybe six girls are, maybe five girls perhaps, are having
Yeah.
PCOS. It's that
Yes.
common. And this is going to be the menace of the century, I think, because this can lead to infertility issues later on. It can lead to even uh, body shaming. I'm really sad to say that this is what is happening to girls these days, because nowadays everything is centered around a certain kind of figure, a certain kind of weight. And when these girls are not able to lose that weight, so when they put on this weight in adolescence and not able to lose it until their 20s, then the body image problem starts, and then they go into their shells. And then now that it doesn't make any difference because I'm already depressed, so then they get into what is called as emotional eating. They get into a condition called as emotional stressful eating. Stress eating is another big problem these days, Swapna. This is a conversation, so I'm taking liberties. I'm not sticking to
Please
a
do, please do.
format.
These are very relevant for
Yes.
women themselves as well as for mothers who have children also to understand this.
Yes. So this is something that is, and this needs to be corrected at the outset, because after a certain stage, when the BMI exceeds maybe 30 or 35, then after that, it doesn't any longer remain something which can be corrected with lifestyle. It probably will need harsher remedial actions, maybe an endocrinologist intervening with hormonal pills. Sometimes they might have to take anti-obesity pills, or sometimes surgeries, and more and more harsher measures. So something that can be prevented easily with lifestyle needs to go on to drugs. So I would definitely, this is something I would make an appeal to all young girls today and their mothers, that please be on the lookout for this thing. Nip it in the bud. Make sure that whatever you can, take your physician's help. Ask, you can even take a nutritionist help if you like, under your physician's guidance. And proper nutrition, rest, recreation, exercise, these are very important. Nutrition, of course, we know this can be another like topic for another day. We are talking
Yeah.
about mental health, but
Hmm.
this is what I'm saying, is that this is what happens when this is physical and mental health, how
Hmm.
they're intertwined. This is an example of that. PCOS is a perfect example of how physical health, when it is compromised, goes on to mental issues, emotional disturbances, even severe depression. And then that severe depression goes back to physical ailments. So this is the entire metabolic syndrome that a girl can get into if this is not corrected.
Hmm. Hmm. So this is about the younger, and I'm sure that anybody who
I hope I
listens
have
to.
answered that question.
Yes. So, what are the first steps to be taken by a person who's probably heard, knows what should this person do? Somebody
PCOS
who knows.
patient, you mean?
Yes.
Yes,
Yes.
so if it's the patient is already diagnosed with PCOS, has a problem, obviously the physician is going to guide her. If it can be corrected with lifestyle, many cases lifestyle, but you need intervention. I'm a homeopath, so I will give the constitutional homeopathic remedy to correct, because we will try and get to the root of it. Because we
Mm.
believe that pathology manifests later. The disease has started much before, at a dynamic level. So we try and get back to why and how this happened, and whether there was some kind of a trauma or some kind of an emotional breakdown that the girl has ever faced at any point in her life. It doesn't have to be a major trauma. It could be small little disturbances, that sometimes an
Hmm. Hmm.
unfavorable environment at home, sometimes lack of confidence. It could be just a very sensitive girl who's probably being affected by ridicule because maybe she's dark or she's thin or she's fat, and she faces these kind of there's a lot of objectifying going on even in schools these days, and this can affect girls' confidence greatly. So because you have to fit into a particular kind of module,
Template.
and if you're not fitting into that, then self-esteem can take a huge hit. So these girls generally then we try and get to that and see if that can be corrected with the constitutional medicine. Whenever necessary, a gynecologist may need to step in to sometimes correct the hormonal imbalance through certain remedies. And if it's in the preliminary stages, then definitely we can help the child get over this very quickly in a few months. And of course, as I said, correction of lifestyle measures, those are a must, because no amount of medicine is going to help if the lifestyles are not corrected. If she's not going to exercise, if she's not going to have a proper diet, not enough rest, if that does not happen, then
Hmm.
no medicine is going to help. So it has to be a combination of all these things.
Also, women go through a lot of transition in life. So from a girl getting into
Yes,
puberty, then getting married, then having children, then perimenopause, then menopause. They're constantly one after the other. Changes
yes,
keep on happening, and they can't be wished away. They have to be there.
yes,
How should
yes.
women give us a general template for a woman to think and about dealing with these kinds of
Yes.
transitions which come to their lives?
Yes, Swapna. In fact, a woman undergoes profound changes, both at a mental, emotional level as well as a physical level through her life.
Absolutely, absolutely.
And
Yeah.
every stage, every transition comes with its own set of issues. So
Hmm.
whether it's adolescence, pregnancy, menopause, and postmenopause, any of these things. So all these are though they're physiological stages. They are not really pathology. They are not diseases by themselves. Even
Yeah, yeah.
pregnancy is a physiological process. It's not a disease at
Absolutely.
all.
Hmm.
Menopause is not a disease, but they're associated uh, with issues that could flare up into a disease if not taken care of at the right time. So, for example, as I just mentioned, that adolescent girl needs to be, you really need to invest into an adolescent girl, because she's going to be the torch bearer, for the later generation. So it really needs to at the outset. So you need to nip all the problems in the bud at that stage. So whatever it may be, whether it may be weight issues, it could be hormonal issues, whether it could be even her skin problems, her nutrition, all that needs to be taken care of at that stage so that she doesn't face those problems later on in life. Of course, as the girl transitions into an adult woman and then she gets married, again, marriage brings its own set of issues which she needs to deal with. So here there could be mental transitions, because as she's going from one stage to another, she undergoes transformation at both the mental and the emotional as well as the physical level, and she needs to be helped also. So whether it's
Yes.
counseling, whether it's a doctor's advice, whether it is your elders around you who know what needs to be done, if that help is taken, she can transition through all these stages very smoothly. Even regarding pregnancy, a pregnant woman, unfortunately, especially in our kind of a setup, is a pedestal. It doesn't have to be. A pregnant woman can be active through her pregnancy. She can do everything that the other women are doing because it's physiological. It's not a pathological thing. But in understand that good activity, nutrition, and rest, and of course, a
Hmm.
lot of emotional balance is required during this stage. This is
Hmm.
important. If she does that, there is no reason why she cannot be active until she goes into labor. Even
Hmm.
postpartum, there are problems that affect women postpartum after delivery. So those need to be addressed as well. So at every stage, so even menopause now, nowadays, there's a lot of um, advice given to
Conversation.
women when they enter that
Hmm.
phase. And everything, whether she's irritable, she's angry, she's upset, she's sad or depressed, oh, this is menopause, this is menopause. Perhaps women can get away with murder as well at that time. So, but everything doesn't have to be. Some women can sail through menopause. Because again, as I said, it's a physiological difference. There's no reason to believe that, oh, I gained weight after my pregnancy or gained weight during menopause, I'm not able to lose it. There will be a little difference. There will be difference in your body contours. There'll be some amount of weight that you will put on, but there doesn't have to be a drastic change. And all that is probably because so this is very, very, very strange, Swapna, when I think about it, is that women sometimes are so harsh on themselves, and sometimes they give themselves liberties where they should not be giving. So this is the paradox which happens with women. So where it's necessary, they are not taking care of themselves, and where they shouldn't be letting themselves go like this. So it's important to invest in your health, in your bone health. Yes, that's very important.
Hmm.
Investing in your bone health. Most women do not really take care of their bones, and any kind of disturbance is there. So during adolescence and pregnancy, if enough nutrition is not taken, enough care is not taken, this can trouble you through menopause. So osteopenia, osteoporosis, which is weakening of the bones, thinning of the bones, can happen very, very drastically at menopause. And remember that your hormones, whether estrogen or progesterone, are going to be your protectors until menopause, because they help you against cardiovascular issues. They can help you against high blood pressure, against diabetes. But the moment you cross that barrier, once estrogen starts depleting, then the risk factors that a woman faces are almost identical to those of a man of that age. So we often, a woman experiencing chest pain, for example, is often ignored as acidity. Oh, it's acidity. Whereas a man complaining of chest pain, oh, rush to the cardiologist. And we have so many women suffering from cardiac issues these days simply because they thought it was acidity. And oh, how can a woman have a heart issue? How can she ever have a heart attack? It's that kind of a mindset. So you have to understand that these are the transitions that you have to particularly take care. So though they are physiological conditions, the problems associated with them need to be watched out for. And
Yeah,
this
I just love this term that you introduced, that it's physiological and not pathological. So all these changes are physiological. And I agree with you that women are extremely harsh and also extremely indulgent, both in very wrong ways. So I have a request. Why don't you? There are men also who are watching and would be watching this section. And you said that women have to take this as a transition, which is physiological and not pathological. But yes, they have to be supported with the supportive environment from all around. So if I were to be a man and you were talking to me, and if I was a father to an adolescent, a husband to a young wife, and probably a woman who's maturing and going through menopause, what is it that men can do to actually support women as they transition through these phases of life?
That's such an excellent question, Swapna. As I said, that women either get into the victim mode
Mm,
or they get into the caregiver mode where they're self-effacing mode, where they're completely
mm, mm,
sacrificial doormats. So both these extremes are not good. So
mm,
let's talk about the father first of an adolescent
mm,
girl.
mm, mm,
So his role as a father is as equally important as his wife's, because sometimes so many girls say that I can confide in my father more, because girls are generally closer emotionally to their fathers. So
mm,
they must recognize that what exactly is troubling my child. They should pick up signals that a child sometimes may not be able to convey, especially when it's about low mood, somebody's troubling her in school, body shaming issues, or sometimes, any kind of abuse, even if it's a emotional or mental abuse and not necessarily physical abuse, but any kind of abuse, the father must be the first one to pick that up. Mothers sometimes get emotional, sometimes get a little, generally it's when it's in a mother-daughter conversation during adolescence, it's the histrionics which come out. There's a lot of drama. But with the father and daughter, it could be more objective, more reasonable, more to the point, more precise. So he should be able to do that. And most important, when the girl is in that stage, she's emotionally also very vulnerable. So at such moments, it is important that the father and mother speak in one voice. A discordant note amongst parents is quickly picked up by the child. And much as we feel that it affects them, it does affect them, but they can take undue advantage of that. So, for example, if the mother says, no, you're not going out after 7 p.m., and she goes to her father and says, I want to go for a sleepover to my friend's place. And the father says yes. So she will keep going to and fro, to her either parent. So the parent who supports her in these kind of things becomes her hero at that time, or her heroine. So she will look up to that parent who generally gives in to her demands. So both the parents must understand that even if they have differences in certain ways, certain things, that must not be obvious to the child. The voice that goes out to the child should be one. And then whatever disagreements you have, please, sort them out later in the child's absence. Because it's not necessary that both parents are right or both will have the same perspective or both they may not do it deliberately. Every parent wants the best for the child, but sometimes one parent may be more mature and understanding what the child is going through. But in such moment, because it's the most vulnerable phase in a girl's life, the adolescent phase, and this at this age, whatever impact, whatever impressions are there on the mind will perhaps last through life. So this is the suggestion I will give to the girl's father, and of course,
Fathers.
nutrition and exercise and all of that.
Hmm.
Regarding a pregnant woman, like maybe like before that, let's come to marriage, post-marriage. A woman will, most of the women will go and live with their husband in his house. Sometimes it's a joint family, there are parents-in-law and other members also. The food habits are different. The time that they get up may be different. The way they entertain may be different. The way they live may be different. The toothpaste also changes. So, so these are the things. So the husband, for the first 6 months to the year, he has to be patient. He must understand that the woman is undergoing this transition. It's not easy for her to look at her mother-in-law as her mother and her father-in-law as her father, and as to her spouse as the only like person in her life. Like he's like the everything that to her, because she's had most of the girls these days are educated. They have their own careers, their own lives, their own sets, their own social circles, and to kind of put that on the back burner and come to into another family is not very easy. Having said that, it's not easy for the man either. I mean, I'm not putting the woman on the pedestal. It's not easy for the man because he has to give in sometimes. But giving in for, I would tell the man, like in one line, is that make some small compromises now with your wife, so you don't have to make big ones later. So make the small ones. If she says, okay, I need to go out on every weekend, I need to go here, just give in, just pamper her for this first year. And then when the boundaries are set, everything is set. When she's comfortable in that house or comfortable with his way of living or the way things are in their home, then you can, then it might be because now the foundation is a little stronger. So this is the post-marriage thing. And then, of course, the motherhood experience for the woman, again, it's an entire transition because for a man, it's a few seconds. Pregnancy for a woman, it's probably 10 months and beyond, forever. So it's an entirely different experience for her, for the new mother especially. But again, as I said, that there is really no need to blow this out of proportion. Pregnancy is an entirely physiological, normal process. The woman doesn't become a goddess just because she's pregnant. Nor does she become a goddess because she's given birth to a son, maybe. So it's a she has to take it in her stride. She has to live normally. There will be some extra nutrition or some nutritional supplements that may be required. A doctor is definitely going to advise her on that. But she doesn't have to eat for
Hmm.
two. It's only in the second trimester that she perhaps needs to eat a little more or eat. So most of the time, if
Hmm.
she had invested in her health in during adolescence and early adulthood, motherhood should be a very easy experience for her. And then, of course, she needs to juggle that. She has to get back to work. So that is a time maybe a counselor can help her, or a husband needs to be more supportive. Most important is the menopause. The menopause is the time when she's going to need support from everybody, because this is the time when she may undergo changes which she herself doesn't understand, especially mental, emotional changes. Physical are obviously happening, but mental and emotional changes. And that is a time when it's a very, very different time, because the children are now grown up mostly. And the husband is probably at the peak of his career. And the woman is also a careerist. Then maybe things might be slightly easier for her now, because now that the domestic burden is slightly lesser. But she doesn't now, she's not able to understand the changes that are happening in her body. So many women come to me and say that I hit the gym for 2 hours. I go for swimming every weekend. I'm doing yoga. I'm following a nutritionist advice. I'm not able to lose even 1 gram of weight. And why is that? They're following everything which is good, everything which is healthy.
Hmm.
Everything now, everybody's off wheat and you're into millets. into oats in the morning, and there's a high protein, low carb diet, everything's being done, the works, and they're not able to lose weight. And then, so this is what I tell them is that this is a cumulative effect of everything that has happened to you over the years. What the environment has done to you, what stress has done to you, and what you have done to yourself. So it's a combination of several factors. And this is why it's not now, it's not happened in one day. It's happened over the years. And this is the time to sit back and understand why this is happening. Women generally today are either in the fight or flight mode. As I explained to the PNEI axis. So what happens is that fight and flight mode, so the hypothalamus and the pituitary are constantly secreting cortisol and adrenaline. So you're in the sixth gear all the time. And when you're in the sixth gear, what happens is that you need to come down to neutral, but you have to first go to the fifth, fourth, third, second, first. You can't just come down with the third. And this is what happens. You come down with the third. So the increased cortisol, the stress hormone, cortisol is a stress hormone, that affects your sleep. Most of the women are not sleeping well these days. Most of the men also, I think it's a general tendency that sleep quality has been affected. And I think it's because of modern lifestyle, probably the way we eat, think, the way we, the blue screen has a lot to do with that as well. So they don't sleep well. And then the melatonin, which is the sleep hormone, that is going to affect your appetite center, your satiety center. So women have unnatural cravings. They're going to eat when when they are not really hungry. And they go on putting on weight. So while the main meals may be normal, very healthy, but this in between snacking, which happens, or they go to there's a lot of people eat out now. They eat in restaurants, eat at functions, parties. And then they call it that, oh, my nutritionist said it's okay to have a cheat day. Cheat itself is such a wrong word. So, you think that, so you are punishing yourself through the week to indulge over the weekend. So what happens is that the cortisol is constantly high. So it's high through the week because what am I going to eat? What am I going to eat next? What am I going to eat next? And then they eat over the weekend, and then they go on the guilt trip, which again increases the cortisol. And then this resist weight loss. So this is what happens. So this is the change that happens. And everything is then menopause becomes the enemy. Menopause is blamed for everything, which is not really true. If she takes enough care of all these things, there's no reason why menopause should become the culprit all the time. So these are the phases. And then, of course, post-menopause is another thing. Post-menopause is once everything is done, post 60s, now bones have become brittle because you've not taken care of them and you've not invested in your hobbies, in your recreation. You've all the time being on that high mode. And now your body is beginning to
Crumble.
protest, rebel. And now you need to go in for that knee transplant, to go in for your cataract removal. Your spine is showing something, your hair is falling. So all these factors also happen. So women go through all this, but this is completely preventable, Swapna. There is nothing that cannot be corrected, but it needs to be corrected at the outset.
Mm. I
So
think
this
it's
is
a
what
family thing. The whole family has to be on a
absolutely.
journey.
So the as I said, for the husband's role becomes even more important in the menopause when his wife is undergoing that. Unfortunately, very few men understand this because the signs are so non-specific. The woman looks irritable, she looks depressed, she wants vacillating moods, changing moods. So he thinks, oh, she's just getting hysterical. So he stops paying attention to her. He's on his own high because he's probably reached the peak of his career. But the woman is undergoing all this. And this is the time when both of them need to sit down and understand. He must understand what she's going through. She must be able to effectively communicate because it has to be, even the complaints need to be well defined. If they're just broad all the time, because what happens is that very often is that in a conversation between a menopausal or a perimenopausal woman and a husband, is that the complaint starts, okay, you didn't call the plumber or you didn't call the electrician or whatever, you didn't get this fixed. But all the skeletons come out of the cupboard and it's an entire histrionic display. So the main complaints, the well-defined issue, which she should have brought to the fore, goes into the background and she appears as a complaining, hysterical wimp, which is so wrong, which is what she doesn't deserve. Right? So this needs, and perhaps then it should go for joint counseling because I think we have excellent therapists
Yes.
and counselors these days, and counseling is something which is greatly undermined actually, and perhaps needs to be Because going to a counselor is kind of, people think, oh, it's, um, uh, nobody
Something's
wants to
wrong.
say that they're consulting a counselor because it doesn't seem so in. It
Hmm.
kind of is a reflection of your weakness. But
Hmm.
it could be perhaps included in at these stages in a woman's life.
In
Perhaps not.
fact, I think tiding over physiological transitions are best supported by counseling, because if you do not, then they end up as pathologies. Then you need
Absolutely.
to go to a doctor or a
Absolutely.
psychiatrist then.
I agree with you there. Yes.
Yeah, I think this was wonderful that we spoke about it. I did not plan to, but I thought it's so important because 50% of the world needs to get involved in the rest of the 50%, battling through these transitions just because of the way the body is
Yes.
made and designed. So, if you were to just tell women three things that they should be doing every day to take care of themselves. I know it's a very, but what happens is because of the way social media is putting content out these days, people kind of resonate that, okay, if I do these three things, then probably things will. So which are
Yes.
those 20% things? If you do 80% things, are at least taken care of. Tell us in the terms
Yes.
of one, two, three.
True. Yeah. So, as a doctor, as a healthcare provider, the three most important things. I mean, as you ask me this, I'm trying to remember because there's several things I could tell. But the three most important things I would give advice on would be for a woman at whatever age that movement is important because if you don't invest in your bone health, in your muscle health, in your mobility from early age, you're bound to be strapped to the wheelchair in your 60s or 70s or 80s, maybe. So movement is extremely important from every point of view, not just from your bone point of view, from for your hormones, for
Mm.
your liver, for your digestion, for your weight, for everything, and for your mood. Walking, running, exercising is the best antidepressant. So at least you don't have to hit the gym. Not everybody can hit the gym. If you can, it's well and good. But if you don't, it's all right. Just walking or getting into any activity, swimming, cycling, whatever you can manage for 30 minutes of the day. If you can do that much and try and do that on a regular basis, that is very important. So this is the first thing I will tell. Second, I would say is, of course, nutrition. That is important. But more than nutrition, there is something which I think is the foremost thing. And I think now physiologists and doctors all over the world are recognizing that disturbance in this factor is the key to every disease, is probably causing every problem under the sun. And that is sleep. Sleep is something that women always compromise on. And as I say this, I'm pinching myself as well. So sleep is something that every woman must be able to invest in. And about it doesn't have to be too many hours, even 6.5, ideally 7 hours, they say. But deep sleep, refreshing sleep is something that has to be, if you don't get it, then you must take help for it. But sleep is the most important because sleep regulates everything. During sleep, it's your protein buildup that happens, your old cells get broken down, there's repair that happens, that the deep melatonin that you get, that sleep offers is going to help your skin, is going to help your bones, your muscles, everything. It's going to affect your mood, most important, your energy levels. So many people these days, it's even men and women both come to me saying that I don't get good sleep at night. I wake up often and I have difficulty in falling asleep. I don't feel I don't feel like springing out of the bed in the morning. And then I'm drowsy through the day. But when I get into bed, I'm very tired. It's not that I'm not working hard. I'm very tired. But when I get into bed, I'm not able to sleep. This is a very, very common complaint. And this is probably because your mind is overthinking. Your body is not tired, your mind is tired. And the mind tired is not going to help because your body must be tired for you to sleep. So try and remember, if you're exercising enough, if you're being active enough, just hitting the gym for 45 minutes and then lazing through the day or having a sedentary life through the day is not going to help. So regular movement, even if it is a 3-minute exercise, just going out for a walk, listening to music, taking that time off. So sleep, I think, is one of the most important things because that regulates everything. Your entire hormonal cycle, your entire PNI axis depends on sleep. And the last I would say is that every woman must take about, or even a man, again, this applies to every human being, take out about 15 minutes at least of the day to pause, to rewind, and to reflect. Take that much time. Understand what happened during the day. Sit, you don't have to, just sitting and doing nothing is a great piece of art. It actually regulates everything. It brings your body down from the sixth gear to the neutral in a very, very phased manner. And that kind of is extremely, it's extremely therapeutic, believe me. And it's not easy. A lot of people have difficulty in doing nothing because you're all the time doing something. So unless I'm doing something, I'm not productive, I'm not good, I'm not normal. I can't just sit and not do anything. But sitting and not doing anything for 15 minutes of the day is extremely therapeutic. So that is the time you can pause and reflect. So these are the three things. And you'll be surprised why I haven't mentioned only nutrition and diet, and but these are the three things. So movement doesn't mean only exercise, just move all the time. Move. Two is sleep well,
Sleep.
and three is to pause and meditate. You don't have to meditate, just sit and reflect. That's
Yes. Mm. I think movement is medicine, as you
it.
said. Movement is
Absolutely.
medicine. Restful sleep is medicine. And even pausing is a tonic.
So this is a combination of how you can intertwine physical and mental health.
Hmm, hmm,
This
hmm.
is this is actually a combination of both, right? We're talking about overall health. We're talking about uh, total and holistic health. So this is holistic health. You're concentrating on all the three things. Unfortunately, we only concentrate on the diet part, and you can really eat a well balanced diet. And if you are sleeping well and exercising enough, there's no reason for you to go on special diets. But you need to it before you get to the point where you need a lot of attention regarding that. I think it's time to kind of take note of that at the very beginning, because I'll tell you that good sleep and the meditation that I said, and enough movement will also improve your focus, your concentration, your cognitive abilities. People
I
generally have
can
become
totally
slow.
vouch.
Yes, yeah. The short-term memory loss, everybody's complaining. Everybody thinks, oh, will I get Alzheimer's because I don't remember? I opened the refrigerator and I forgot why I opened it for. I go from one room into another and I forget what I came there for. Am I developing Alzheimer's? So this is not Alzheimer's. It's just that your hard disk is completely crowded.
Full.
Please erase all the useless matter from there, and you'll find that you can remember everything that needs to be remembered.
Yes, I can totally vouch for this. I can totally vouch for this. And many people say it's so hard to sit in meditation. I think that's the biggest ability that we need to develop of sitting and doing actually practically nothing
Yes,
and forcing the mind to not do anything. I think that
yes,
practices another kind of a neuromuscle. So for you to focus, so every time that you're meditating, that's what I explain to people, that you're actually coming back to one point, and that's what you want in life, right? Come back to that
absolutely.
and not get your mind
Yes,
digress here there. So and each of these are so interconnected. If you move, you'll sleep better. If you sleep better, you'll have less of a mind crowded because you would have dealt with things in a more focused manner the next day. I think,
yes,
and I'm glad that you mentioned that you did not mention nutrition because it's overstressed right now at the cost of the other three that you spoke of,
yes.
which is movement, sleep, and the time to pause. And Sujata, I feel happy to tell you the first conversation that we started at Bodhi Stree for mental health was to talk about nutrition, and we had a homeopath doctor who's actually transitioned into nutrition now because she thinks food is medicine. So she's transitioned into that, and so whole conversation was all about how should we look at food, how should women look at food differently
Yes.
than others to actually regulate their body. So I think what you've said is very, very profound, and if we do these three things also, other things will take care. Now, I one last thing, Sujata, before we close. I know we've got very little time. Another thing which I see the world and sometimes even I, battling with is consistency. Because what everybody starts on a high to do something well, like watching you, hearing you, listening to you, they would say, "Oh, I'll start," and then we just drop the ball. So, when you look at as a healthcare provider, what do you think consistency? How much of a little every day and a lot done very few times, how do they measure up against one
Mhm.
another? Because I think we often lose the plot there.
Yes, thank you for asking that actually. And as I mentioned earlier, that you need to pick up subtle signs at a very at the outset before it becomes a
Mm,
big thing. And health is not really just absence of disease. Health is a harmony between your spirit, body, and mind, everything together. And that can be only achieved by discipline and consistency. And by that, I don't mean that you need to do grand things. You don't need to take up big things, big diets, big nutrition, too much exercise. It's daily, simple, consistent habits
mm, mm,
that
mm,
sets the ball for a good, healthy life later. So daily, consistent habits, which must be inculcated from the outset, from the beginning, which we have been. We're all grown up in families where there have been good habits instilled into us. And unfortunately, over the years, because of so much of influx of information from everywhere, all over we now live in a global environment. So people are having South Indian breakfast and then Punjabi lunches and then they have continental dinners. And this is messing with your system. I'm not just talking about food, but about general lifestyle. So if you are consistent with whatever you do, occasional indulgences are okay. I would say an 80-20 ratio, whether it's your
mm,
diet, nutrition, everything. 80% of the time you stick to your habits, stick to your discipline. And 20% you're allowed that little liberty, whether it's, you should be flexible as well. Because rigidity again is bad for health. So rigidity is not good. You can't set yourself into it. That's why you see that why are people who are into so much of exercise or who are marathon runners and they suddenly die sudden deaths because of rigidity. I must get up this time. I must run 10 kilometers. I must do this. I must have only a protein breakfast. It's must, because they are actually punishing their bodies. So flexibility is also very important. So consistency in your daily routine with some amount of flexibility will actually set the tone for a very healthy life. And most
mm.
important, Sapna, I would say that it is so important to listen to your body. Your body is telling you something all the time. It is giving you subtle signs. It is giving you that little persistent irritability, a headache which is not going away, digestive disturbance, constipation, gas, or a skin problem, an eczema, which is a rash which is continuously there. These are your body signs that your body is trying to tell you that something is not right. Something is not. So it's an emotional symptom. It could be a physical symptom. It could be a mental symptom. But anything that is persistent, please take note of it. Do not brush it under the carpet. Please see a doctor, your GP, or a family physician to get that diagnosed or to understand why this is happening. It may not be as serious as it is. It could be an innocuous thing, but it must be addressed. So listen to your body because your body tells everything that your body says, your mind is going to note. Every disturbance at the mental emotional level your body is going to reflect. This is very important. The body first whispers. It whispers before it starts screaming. So when it whispers, you listen to it. Listen to your constitution when
So
it's whispering that
I
something is
have
not
one.
right. Take
Yeah,
it
I
in.
have one question,
Yes.
Sujata, and I know we're over time, but you'll give us another 5 minutes for this. Is that, these days, our first go-to is the internet. So suppose I'm feeling some ways, and I feel it is okay. The way my search will be designed will be such that the internet tells me that what I'm thinking is okay. Now, give us a way by which we should get away from the internet and learn to listen to our body with faith. Because I am continuously seeing when you're talking to people, and if you even try telling somebody this, they'll say, no, I've checked it out, and this is perfectly okay to be like this. I mean, how can I tell them that, what is there on, say, John Hopkins' site is wrong? Because without context, everything is wrong. So, I mean, this is a menace that I'm seeing, especially
Oh,
amongst
yes.
women.
While social media is a great tool, but it's a tool. It's not a
Hmm.
substitute for
Hmm.
for the counselor, for the therapist, for the doctor, for the physician or the surgeon. It's not a substitute.
Hmm.
So if there is something wrong with you, first try and understand. Because see, the human body is a dynamic entity. What applies
Hmm.
to you may not apply to me. The disturbance
Hmm.
that you experience may not be experienced by another person experiencing the same disease or the same illness. So we are all unique individuals. So individual responses to anything vary so much. But if you have a headache and you put it on the internet and they will tell you, oh, that could be a brain tumor, and the person goes into depression just thinking that I have a brain tumor because all the symptoms match. The intensity of the headache, the weight is It's sharp, shooting, one-sided, so it has to be this. So this is the kind of era that we are living in. But I would definitely suggest to everybody that do go onto social media, because content is now everybody's right. But do not replace that. Do not go to the doctor with a prejudiced diagnosis in your mind. Oh, yes, I think this is what it is. Do you think? And patients are going to the doctor just to understand
Verify.
what they read on the internet, whether it's correct or not. But what is important? What are you experiencing? What
Hmm.
is wrong with you? Please share that
Yeah.
rather than giving the doctor a diagnosis that the internet is
Yeah.
suggesting.
So, you know what I was saying, Sujata, people avoid going to the doctor because content on the internet will tell you that what you're going through is okay and this is the way it is. Because somebody probably is selling or getting some commercial gain by you believing in such a thing that it's okay to be like this. How do women know what they're listening to insides is correct is only by checking with an expert, is what you're saying. I think it
Absolutely.
is best to to trust what your body is feeling and go and check it out with somebody whom you trust. And it's great to actually have a trusted doctor by your side and as you live
Yes.
life is what you're suggesting. So till you find that one person, I think it's important to keep looking for
Yes, and it's very important that you consult a generalist first,
and not a
Nowadays,
specialist.
because
Yeah.
doctor shopping is so common that you have a sprained knee and you will go to visit the orthopedic. But a knee pain is not necessarily an orthopedic issue. It could be anything. It could be inflammatory, it could be orthopedic, it could be a medical issue. But you go to your generalist, your family doctor, your GP first, get it ruled out. He will or she will direct you to the right one, right specialist. Now, this is because this itself will put stress on the person, because if you go to an oncologist first for a growth, which could be a wart, the oncologist will first rule out cancer because that's how he's trained. He's a super specialist. So he will. So until cancer is ruled out, you are going to be suffering so much stress. So this is
Hmm.
what is, so for physical and mental health. It is important that you go step by step. As I said, you
Hmm.
need to go from neutral to first to second to third and then to the sixth gear. The sixth gear
Hmm.
is super specialist. And this is what
Hmm.
the person must understand. So as I said, it's a combination of several things, several stages that health can be achieved, and it's very, very important that first recognition of self and then seeking help and appropriate help. This is how you
Hmm.
uh,
Yeah.
achieve total health.
I think that it's been an incredible conversation, and I'm sure that anybody who listens to it will find themselves in the conversation, as I did, Sujata, while you were speaking. There are many things that I would think that I'm an aware person, but there are so many things that you took our attention to. And what I've understood is that a woman is programmed. Or I mean, the universe has designed her in a way that she has to go through these transitions in life, and it's important for us to recognize that these are physiological and not pathological.
Yes, very,
And
very
we need to be aware so that we go through these like it's a physiological change and not a pathological one. And I think the environment around us, including the men, need to understand what the women are transitioning through so that they know how best to actually support them in these transitions, because the world that the woman is making is for both. So that support is so much required.
And
So thank you.
conversely, Swapna, like as a final note, I'll say that women must also recognize changes in their counterparts and their spouses, because men go through their own sets of issues, their own health issues, their own stages in
So
life, which are not so well defined, like
So
in
we
a
run a
woman.
series around men's mental health, Sujata, and I would urge you to come over once and speak over there, because I think that's also very important, because
Yes, very, very
especially
important.
men's mental health is just not paid any attention to, which is so
I
unfair.
agree with you. I
So
agree with you
unfair.
there.
And so
Yes.
therefore the rest of the women's world have to then therefore swing in and actually help them tide over it, because they also struggle with expectations, and some of them actually unfair and in this changing world from them. So anyway, thank you so much for making this time for us and coming and speaking to us. And we'll hope to see more of you in the future, as I'm seeing as still works in the area that it does, because counseling is actually so close to our hearts. And you stressed on it in such a beautiful way today. So thank you
Thank
so much for making this time, deconstructing
thank
and
you.
unpacking this entire idea for us. And we leave the conversation wiser than before. So thank you so much for
Thank you.
coming over.
Thank you so
Namaste
much,
and
Sapna.
namaste.
Thank you very much. It's been a pleasure. Thank you very much.